Okay, let's begin. So usually magnitude of problem affects 15% of all the patients with diabetes. Prevalence of active foot ulceration varies from 1% in Europe to 10%. Usually foot ulcers you need to identify. Calluses you need to identify, that is 2% per annum. Foot problems 25 to 50% of all hospitalization with diabetes. Diabetes is the leading cause of non-traumatic lower limb amputation in the world. This is actually true, and you would not believe you. It's actually it was an information to me a few months back that the cost of treating diabetic foot is even more than the other complications which are being treated, owing to its hospitalization and stays. Usually, you have a longer stays, and those who are amputated they need to stay even more longer. So over 1 million lower limbs are lost due to diabetes. Every 30 seconds it's there. So these are all data. 1 lakh lower limbs are lost due to diabetes annually. And 75% of these amputations are neuropathic feet with secondary infections, which are potentially preventable. So these 75%, if they get admitted in the hospital, of course, they will require admissions. In that way, the costs increases. So the predisposing factors for the foot is large and small vessel disease, chronic sensory and motor neuropathy, uncontrolled diabetes. Of course, it accelerates that susceptibility to infection because of low immunity, and autonomic neuropathy, which sets in because of the accumulation of AGE, advanced glycation end products, leading to the dryness of skin and local deformity. So what is the neuropathy? Leads to lack of protective sensation. Insensate foot leads to injuries that remain unnoticed. Motor neuropathy usually causes loss of power in muscles and in the lower foot altogether, which leads to hamartosis. We'll see the photos. Deformities lead to development of pressure points where the calluses develop, predisposed to development of Charcot foot, and autonomy neuropathy leads to reduced sweating, which is a common complication of diabetes, dryness of skin and fissuring. So if you see, this diabetic foot is an amalgamation of macrovascular and microvascular complication of diabetes, and it is actually an extended version or extended form of peripheral arterial disease, which is also a kind of macrovascular disorder in diabetes or complication in diabetes. So if you see these great toes, they are actually having calluses which have been developed due to improper footwear. And if you see, these develop only on the pressure points. So calluses, always keep in mind, calluses will develop, or neuropathic foot will develop only where there is adequate blood flow. Thick callus can press the soft tissue and cause ulceration. If callus is not removed in time, it leads to tissue necrosis, leading to formation of ulcer. That is a neuropathic ulcer, which is commonly known as a trophic ulcer. So you see the neuropathic ulcers, they have become so deep. So even if you touch these feet, you will find them warm actually, and with pulses. We'll discuss that also later in the subsequent slides. Ulcers in neuropathic foot. So I am trying to tell you this is sensory neuropathy, which you won't feel it, but they are having this toe ulcer. Sensory neuropathy, erosions of dorsum of foot. These are very common complications. So if you have an eye for diabetes, even if the patient presents to you, and if you see their nails, the quality or the situation of nails, you could identify, you can screen them even for diabetes. Deformities found in the neuropathic foot, as we mentioned, the glottos due to the pressure points and calluses, and the hamartosis. So you see the distances veins on the dorsum of the foot of a patient diabetes with autonomic neuropathy. Usually, most of the Indian people are habitual of walking barefooted. So barefooted walking is also one of the things which should be taken care of and advised to the patients in time, so that they should not. So these are the distended, and these veins, usually you will see the distended veins in each and every individual, mostly in India, but the distended veins beyond 5 mm, and they should be calcified even. So you can feel them a bit hardness as compared to the normal veins. Charcot neuropathy is in the diabetes. So it's a relatively painless, progressive, degenerative arthropathy of a single and multiple joints caused by an underlying neurologic defect. Actually, neurologic defect is due to diabetes. Complication of the uncommon complication, prevalence is just 13%, found in both types. and found in both types. Usually unilateral bile occurs in individual diabetic more than 12 years.